All right, so that was route number 2. You've got your A and B. You've got the supplement or the Medigap plan covering the medical. You've got the separate Part D drug card covering medications. Now this is that option number 3, the Medicare Advantage plans, also known as Part C. Okay, so here, this is very different than what we just went over. With this, you are replacing original Medicare in terms of them paying anything toward your claims. They are no longer paying your claims. They're no longer deciding what services are going to be covered. That has all been outsourced to your Medicare Advantage plan. Okay. One thing people like about Advantage plans is they do tend to throw in some extra services. So you've probably seen commercials on these. These are the ones that throw in things like dental, vision, hearing aids, transportation to your doctor, Meals on Wheels, right? There's just a variety of these little extra services that the Medicare Advantage plans will provide to you that the supplements don't, because Medicare itself doesn't cover it. When you go this route, however, you are choosing a fairly specific network of doctors. So you're in the world of choosing an HMO, PPO, private fee-for-service. Point is, here you're going to be fairly localized to your service area. Going to want to make sure the doctors you want to go to are in network for the particular Advantage plan that you have. Let's say you do decide to go this route. Now, instead of just having a small amount like $233 out of your pocket, you're going to have cost share when you go in and use Medicare Advantage plans. So there could be deductibles, most definitely co-pays, co-insurance, and some sort of max out-of-pocket limit, right? So they all vary a little bit, but let's say a specialist visit's, $30 to $50. Hospital stays $325 a day for the first week or so that you're in there, right? So every benefit, you'll look at the guide, and every benefit will have an associated copay, and those copays will accumulate towards some maximum out-of-pocket limit. And those range anywhere from $34.50 to $75.50 this year. Most of the Advantage plans we're going to deal with are going to have the drug card built in, so you don't go get a separate Part D drug card. And again, very similar sign-up window to original Medicare. Medicare Advantage plans are typically going to be lower in terms of monthly premium versus the Medigap we discussed, right? And the rate increases are typically nowhere near as frequent as what you're going to see on these Advantage plans, on the standard supplements, okay? So what are you doing? You're taking that trade-off. You're getting lower premiums and you're getting extra services, but you're going to make sure you stay within that network of doctors, and you're going to have costs when you go in and use the care. So there's that balancing act there. Now, your Medicare Advantage plans can be changed each year. So if you start with Company A's HMO and you want to move to Company B's PPO, you can do that during the open enrollment window. No medical questions asked. So that part's easy. Just like the drug cards, these Advantage plans are sensitive to the zip code and county that you live in. I put here that the plans may not offer out-of-network benefits unless there's an emergency, right? So let's say you're in an HMO and now you travel down to Florida. Well, you come down with a cold and want to go to a doctor, that's not going to work on these Advantage plans. But if you get into an emergency situation, they have to treat you as if you're in network until you're stable enough to be moved back to your service area. Spoken a little bit about the open enrollment window. That's a period each year that runs October 15th through December 7th. You can change your Part D drug card or your Medicare Advantage plan during this time period. No medical underwriting, no pre-existing conditions, guaranteed that you get to switch to whatever plan you want that's available. When you make the switch during that time period, your new plan does start January 1st. And again, I want to stress here that Medicare supplements or Medigap policies, whatever term you want to use, they do not participate in this window. All right, we've got just a couple of cost examples for you here so you can see what a move to Medicare may look like, at least ballpark. Part A doesn't cost anything. Part B, without any high income adjustments, is running that standard 170/10. Good supplement G these days, if that's the route you want to go, somewhere around $100, give or take. It's going to depend where you live, exactly how old you are, household discounts, a lot of factors go into that price. But most 65-year-olds are getting a supplement somewhere around $100. A good drug card these days, typically, somewhere between 10 and 30 bucks. I just put $25 here. So you can see for a full move to Medicare with the Medigap or supplement and drug card route, kind of all in government piece, Plan G drug cards run you $295.10. Here's an example of a Medicare Advantage plan. So with an Advantage plan, you still pay the 170/10 to the government. Quite honestly, we've had Medicare Advantage plans at $0 premium going back at least 11 or 12 years at this point. So no costs on the Advantage plan. Your monthly premium is just whatever the Part B is charging you by the government. Okay, guys, I really appreciate you hanging with me today. Here's my contact information. If anybody does want some assistance with this transition, I would love the opportunity to help. We are an independent brokerage here. I've been handling Medicare for well over 10 years at this point. It's the main piece of the business that we do. Our assistance in this, so helping you understand when and how to enroll in Medicare A and B, helping you shop out the supplements, drug cards, and Advantage plans, getting you enrolled in those, making sure that process happens, and then making sure we are your first point of contact. Once you're up and running, all of our help is completely free. And I truly mean that there are no direct fees you're going to be billed by us. And there are no indirect charges for whatever plan you get. So you go out on your own and you find a drug card and you find a supplement or you find an Advantage plan, you can enroll in that directly. Or if you enroll through us, it is the exact same price. So my stance is always, everybody moving to Medicare is paying for our assistance, whether you want to use our help or not. At a bare minimum, we can make sure we get you in a queue and we're reaching out to you during that open enrollment window, right?